typically, I see about 500 patients with knee problems. I would say 80 to 90% of them got arthritis of the knee. I think that depends on how your general practice have referred you to come and see us. Depends what they put down on the letter and what is your symptoms. Every single letter coming to us, the referral will read them, and it depends on the symptoms. We will prioritize them, and if the symptom is bad, that we think we need urgent intervention, we will put it as urgent. Typically, we will be able to see you within the first 2 weeks, and if something that is imminent, we will be able to arrange clinics to be able to see you even sooner. But for typical routine referral, it's not unusual to be 4 to 6 weeks. Depends on the clinical time, the clinical pressure as well. I discuss with my colleagues about cases all the time. We have multidisciplinary team meeting. We also have case conferences, international and national meeting. We share our expertise amongst colleagues, and we will always discuss different ideas, and we will always want to help to bring the best treatment to you. I think it's very important to engage the patient to work together, because it is a very long journey suffering from arthritis. In order for some of the non-surgical management to work, as well as the surgery to be successful, we want patient, doctor, physiotherapy, their family, relatives and friends all get involved. By tackling it multifactorially, we will be able to beat arthritis sooner, and that's how we should improve the pathway. I think it depends on the patients and depends on the age of the patient. Expectation for a younger patient is very different from an expectation for a retired person. If someone is working, someone is active, I think they need to have a better understanding what arthritis is, and surgery is not often the best treatment options. In terms of for slightly elderly, retired, and get more time to enjoy themselves, enjoy life in a slower pace, replacement may be a good idea. Now, I think this is a very important discussion you need to discuss with your doctor and discuss with your surgeons and explore many different options to deal with arthritis. For me, I would always advocate non-surgical treatment first. These non-surgical treatment could be weight loss, lifestyle modification, injection, bracing, and electric therapy. I think we need to exhaust all these treatment options first before we consider surgery. There's often when patients come and see me and refer for surgery, but actually we want to take a step back. We don't want to tackle arthritis with just surgery, because surgery is very powerful, but at the same time it does have complications. Now, it is very often that in the community you will see the successful knee replacement or hip replacement. People say how great it is, but at the same time in the hospital we will see the patient that didn't have such a good result. With this, we always have that at the back of our mind. If we want to embark the surgical route, we must exhaust all the non-surgical options first. I think online is a very useful tool, and we all use Google, but however, what's available there is varied qualities. There are some sites that have got verified, certified information that is reasonable and that is credible, and there are many websites that make false claims. It is very difficult if you just search on a search engine to find knee pain and treatment. There could be many things come up. So I think it is important to access information through a reputable website with medical professional input. Tibia osteotomy is a highly specialized operation. It depends on your surgeon, the equipment that he uses, the approach that he uses, and the way that he do the osteotomy. It could be opening wedge, it could be closing wedge, it could be different implant they're going to use, or it could be just a plate. There's many different options out there. I think the more important thing for you is to discuss with your operating surgeons what is the process, and I think he or she will be able to tell you better. Well, first of all, it's very unfortunate for you to experience such a traumatic injury. With injury to our knee joint, although if the fracture has been fixed, the bone usually healed. However, the damage done to the cartilage often not repairable. This happens usually at the time of the injury, and at that point, those cartilage cells would have been dead. That would lead to the development of arthritis. You put it quite rightly, it is a post-traumatic arthritis. In terms of post-traumatic stress, I cannot comment because that's more a psychiatric issue. It sounds like you've been through a lot with your hip replacement, and I think for you having fibromyalgia, it is a condition very difficult to deal with. I wonder, is a knee replacement the right thing for you? I think the best thing to do is for you to discuss that with your surgeons and to ensure that it is the best operation for you. And if that is the case, I would suggest you to start doing some prehabilitation exercise to build up those muscles prior to surgery. That always helps recovery.